Right. Hi, good morning, everyone, and welcome to what we believe is going to be a promising event, a panel discussion on the topic of digitalization, digital health, and technology. Uh, what we will discuss in this session is how we can foster a collaborative relationship between the EU and India, especially for open, interoperable, and a secure digital health ecosystem. The digital transformation in health is not just a matter of technological change or technological muscle. It's more of an extensive socio-technical exercise where you've got different cultures, you've got the policy angle in it, you've got politics in it, you've got economics and innovation, and the intersection of all of these that really will transform how we think about digital health in the future. And the EU, given its commitment to protecting patients' rights and digital protection laws and its advanced digital health framework, along with India with its rapidly ever growing digital infrastructure and the tech savvy pool that it has, are, I think, uniquely positioned to take on this challenge and lead the transformation on a global scale. So today we have a distinguished panel of speakers, and I will introduce them in a while. The plan for the session is that we have worked for a while now on a report which was funded by the EU India Digital Think Tanks Initiative. And the idea of the report was to look at the possibilities of collaboration between the EU and India, knowledge transfer and knowledge exchange. So for the first 10 minutes, we will have our Indian representative present some brief findings of that report, and then we will delve into the panel discussion. So the panelists, of course, you're curious to know who they are. We are very pleased to have KAROLINA MACKIEWICZ, I will introduce her a bit more when she joins us on stage. We have Dr. JUBIN SHAH as well, who's based out of Heidelberg. We've got Neeta Tyagi, who's joining us online. Kamesh Shekhar, who leads the dialogue. Kamesh and Neeta will join us online, and we've got the founder of Dialogue, Kazim Rizvi, as well. Um, Along with me, we have a second moderator who is Pavan Ananth, and he will introduce himself when he joins us. So, Kamesh, I'll hand it over to you now, if you can hear me, and we'll be very happy to hear what you are presenting about the findings we have from this report, and then we'll take on the discussion from there on. Yes, we can, yeah, and we can see you. Sure. Yep. Yes, we can, yeah.
Great. Thank you so much, Mujahid, for like setting the context to the presentation and for the panel discussion itself. So, as Mujahid just mentioned, cooperate with India and understanding the context of digital infrastructure which is happening across the countries and across the regions, especially India and be able to understand what we need to do and have the skills and knowledge to implement these changes. basically highlights what are the certain policy level and implementational level concerns that both the jurisdictions may face or already facing and might need to give attention towards as we move forward with taking forward these initiatives. So the objective of actually mapping the constraint is to actually look where is there any ways there's a scope for collaborative learning and knowledge exchange between EU and India in terms of tackling those issues. And for instance, it is if I could give an instance is that EU has demonstrated a high level, an advanced approach towards policy making in data related domains, while as India has been pioneering and championing scaling data systems and making them interoperable, right? So this is what the background of the study has been and what we are trying to achieve. 1A is looking into the constraints and what are the collaborative knowledge exchange that can happen between EU and India and actually solving those constraints. So in tandem to whatever I said as the background to our study itself, the research question has been is obviously the lessons that India could learn from EU in respect to the scope of data regulations of electronic health records or digital health records. And lessons that the EU can learn from India in terms of national health stack with respect to scalability of the electronic health records exchange, particularly on the aspects of interoperability. Then finally, we also looked into the boundary conditions for enabling interaction between India and EU's digital health systems. So the methodology that we followed is two-pronged approach. A is secondary research, where we actually try to use the pestle analysis in terms of getting down the boundary conditions for what are the things that we have to achieve through this study and what are the mutual ways of exchanging could be. And also we did a meta-analytical literature review in terms of finding out what are the existing literature available on the space and where can our research come and fill in the gap. And also we did the primary research where we did some qualitative semi-structured interviews with representatives industry experts, data governance experts, and international relations experts, members of the civil society and from both EU and India, the digital health facilities, and other recipients from EU. So why we did this is we wanted to understand the multiple viewpoints and concerns about interoperability and privacy of the digital health ecosystem in both the jurisdictions in terms of mapping the constraints, and also what the experts have to tell us about what are the key learnings that the both the jurisdictions can actually have. So moving on to that, from there, both the countries, first, let me take you through the constraints faced by EU and India within the digital health ecosystems. We actually know that both countries use different approaches when it comes to how we handle or tackle the digital health records, right? But also we wanted to point out what are the constraints that they might face within the three facets, which is what the first facet that we looked into is what are the constraints they face within the data protection landscape. So one of the key aspects which is within the at the India side when it comes to constraints within data protection landscape is that absence of a legislative mandate. So here we actually try to look into how the ABDM or the national health data management policy was formed. So without a comprehensive regulatory framework, the implementation process and infrastructure actually acts as regulation and substituting or substituting or displacing the parliamentary laws, right? So while the implementation process, which is put out by the the mission statement and etc. and stuff, does create part dependencies and fosters cooperation and structures. However, such frameworks may not really bring flexibility that one needs in terms of legal mandates to establishing rights and delineating responsibilities and providing remedies. So while there was an intention for a draft regulation to support the ABDM system, it was expressed in 2019. We have not seen anything flutational at this moment. So moving on to the next constraint is the lack of higher degree protection to the health data. So we all know that India recently passed the Digital Personal Data Protection Act 2023, which applies uniformly to all the healthcare professionals, providers, facilitators, and etc. But there is no higher degree of protection for the breach of certain categories of personal data, such as health data, which might actually have a higher level of greater level of harm to the individuals. Having said that, like I also want to like make a caveat here is that DPDPA 2023 is not the only legislation available there. India also like has like something called as the sensitive personal data or information rules, which actually caters to the sensitive personal data, which is one of the data is the health data itself. However, there's like a little bit of uncertainty at this moment whether this rules will be absorbed within the data protection regulation or not. So then comes the compliance constraint as like the data protection regulations, the new start within India. There's like a long way to go in terms of like how the industry will comply to some of the universal principles that are actually like prescribed through the legislation itself. This is basically like though maybe the international present organizations might actually like be a little bit acclimatized to this process, but India is a very rich country with ecosystem which has like a lot of startups which are working especially within the digital health ecosystem, and like how they will be like transitioning towards this is a important aspect. And also at this moment, like we don't have a data protection regulator, so who might have been in help in terms of like advising and providing like guidelines and etc and stuff, which might the government might do, but like having a regulator separately doing might have been a little bit of a help, which is not present at this moment. So next comes the rights and the duties of the data principle. This might be overarching, but this can also have implications within the digital health paradigm that we are talking about. Like one interesting aspect, or like one aspect that the Indian government has put within the legislation's duties for data principles for raising their complaints and etc and stuff towards the board. This might actually like have like unintended consequences, like people might be cautious in terms of like not able to like exercise their rights. So then moving on towards the European Union itself, the premises of the data protection regulation is like almost mostly within the paradigm of like how can we protect the right of privacy. But also like the other flip side of the coin is that like how can we actually unlock the value for the benefits the citizens and etc businesses and communities have by using the data, which is like a little bit not much like deliberated, though like EU is deliberating on this at this moment, but GDPR doesn't really do much there. And over the length of the content artifact, this might be like also applicable to India and others, like as GDPR sets the golden standards for mostly within the aspects. Like I guess like this is something which we need to see whether it's going to be available for others. And privacy and value thing is something that the European experts have pointed out, is that how the people with Indian individuals actually have a mindset about like how privacy and value of data is something that is not, like not really sitting in tandem, whereas like they think that if they are actually going to move towards digitalization, they might be trading of their privacy. Scalability constraints, like, we looked into a couple of aspects like infrastructure disparities, where like, one of the aspects is that like India is still moving towards digitalization, and like there is also remote areas where it's not there. And regulatory frameworks is basically we looked into is that is like, there are multiple regulatory frameworks that they have to the digital health ecosystem has to operate, and this could bring a lot of like confusions and civil innovations. Healthcare workforce training is basically, as I mentioned, it works in tandem with the digitalization efforts, where like still healthcare professionals, etc., are not very much like acclimatized towards using digital services. Financial constraint is again like understanding whether there is an importance towards like having any funding requirements for the digitalization. EU level like fragmented healthcare system, which is basically like member states have like different healthcare systems and as well as like follow different formats, and that can actually cause concerns. And again, like regulatory complexity is like a similar aspect that we looked into in terms of how member states keep on like handle these things, and like and how this is going to interoperate. And resource allocation is something that we look again, which might be near to the financial constraints aspect that the India faced. Like, how can we actually like look, towards like making a case for like digitalization within the healthcare system. And resistance to change, this again sits with the point that we mentioned earlier in terms of like the trade-off between like privacy and digitalization, and also like there's a little bit of experts have pointed out there's resistance towards making digitalization. Interoperability concerns that we quickly I want to like cover here is the lack of vertical regulatory interoperability within India, where like, we have multiple digital laws coming into picture and not interacting with each other. And lack of center state interoperability is basically here we talk about is that is there is no in India, the health as a subject falls within the states, and states already have a lot of their systems and data management processes, and we don't know really how this is going to interact and interoperate at this moment. And at the EU level, lack of foundational and semantic interoperability at the private level, because first at the private level, because the private sectors within different member states work differently and follow different systems, and this can bring interoperability concerns, especially at the foundation and semantic level. At the national level, the public health systems also follow different systems, different aspects, which can bring interoperability concerns.
Kamesh,
Um,
can I interrupt you there? You have about 2 to 3 minutes to wrap up, so it would
yeah,
be great
I'm
if you can.
concluding. I just have a couple of slides. I'm concluding. Thanks, Mujaheed. Yeah. So coming quickly into the recommendations part itself that we are talking about is that the three key recommendations that we were able to get from EU's learning is extended additional protection to the health data, where we try to look at India's jurisprudence on data protection is just evolving, and while GGP has done a lot of work in terms of how they protected the digital health and records and the health data and etc. So how can we learn from there is something that the report looked into. And then we move on towards the regulatory interoperability to enhancing the ecosystem. So here we looked into how the center-state regulation, center-state interoperability can work, where India, EU also operates in similar kind of approach. Then we moved on towards evaluating the performance of the data protection regulation. As I mentioned, India has just moved into it, whereas GDPR has been doing this for some time, and there has been constraints which has been faced over the time. But how we can actually systemize this process from the learning from India, some EU is something that we actually looked in our paper for India. Moving on, to the recommendations for EU, laying the roadmap through the digital public infrastructure. As we know, India pioneered the digital public infrastructure frameworks, and what are the key learnings that the EU can actually have in terms of adopting certainly some of the aspects at the infrastructure level for bringing interoperability. Importance of digital health ecosystem and the digital identification system. Basically, it's one of the facets of the digital public infrastructure, and how that is important to have a functional and a foundational ID is something that we looked at the EU level by adopting some learnings from India. And enhancing scalability using ecosystem approach. One important aspect here is that we looked at is that it's within the ecosystem in India, there are various players within the system. They all come and work in tandem, and how can EU can learn from that is also we look. And principle level is simple as that, is that there is a principle level interoperability laid down to the ABDM blueprint, and how that can be adopted. And balancing the data protection and value creation, which is from India, where we try to look at techno-legal solutions, consent management and consent manager frameworks and federated architecture and etc. and stuff. So, and how can EU learn from that? So quickly, 1 minute, final thing, how we actually wanted to, envisage the digital health interaction between you and India. We actually looked upon, one of the key aspects which is important for making this interaction happen is interoperability between the data protection regulations. So while both the jurisdictions are looking at, the data protection aspect itself in a different format and different ways, but there is a underlining through our analysis, we were able to figure out there is a underliningly some of the principles followed by both the jurisdictions are similar. So this can be actually a opening conversation for both of the jurisdictions in terms of actually enabling an interoperability between or interaction between the digital health ecosystem between India and EU. So just I rushed a little bit more, but the study is very extensive. So this is what we did, and I can go in detail during the Q&A.
Right.
Thank
Thank you
you.
so much. Thank you, Kamesh. Thank you for this brief summary of the report. It's an extensive report that we've written over the last couple of months, and it is not published yet, but it will be published soon, so you can watch out for that, and you can follow us on LinkedIn and Twitter and whatnot, because we will announce the publication over there. It is my pleasure now to introduce the panelists that we have for today's discussion. So to start with, we have KAROLINA MACKIEWICZ. I'm pronouncing that right, yeah. KAROLINA is the Innovation Director at the European Connected Health Alliance and a digital and public health consultant. She has over 14 years of professional experience in international projects with international organizations like the WHO, the OECD, the World Bank, and other key regional and national stakeholders. Welcome, KAROLINA. Can you please join us on the stage? Our second speaker is Dr. Jubin Shah, who is a product manager at Clinomic Group. He specializes in leveraging clinical data for strategic decision making in healthcare. His work focuses on product management for new products that are part of the company's data and AI strategy. He is also an alumnus of Heidelberg University and has degrees in biotechnology, life sciences, and bioinformatics. Jubin is a strong advocate of Indo-German bilateral relations and creating a sustainable strategic partnership between the two. So very happy to have you here, Jubin. Can you please join us? We have two of them joining online. So Neeta Tyagi is an expert at the intersection of technology and societal programs, particularly in governance and healthcare. She champions the use of digital platforms and collaborative efforts involving society, governments, and markets to tackle complex societal challenges on a large scale. So she works with several central and state governments. She has over 29 years of experience at global organizations in diverse areas. And she's been working on this topic specifically on national scale digital transformation for the past decade now. So it is a pleasure to engage with you today, Neeta. Thank you for joining us. Um, we were just introduced to Kamesh. Kamesh leads the privacy and data governance vertical and the AI vertical at the Dialogue. The Dialogue is a prominent think tank in India and has been recognized by the University of Pennsylvania as one of the top 10 global think tanks to watch out for. Um, there is naturally a big team of researchers. The founder is Kazim Rizvi, who is a lawyer in India and is a prominent figure in India's public policy arena. So Kamesh is representing the Dialogue today. He is a youth ambassador at the Internet Society and holds a degree in public policy from Takshashila Institution and other degrees from the Tata Institute of Social Sciences. So thank you for joining us today, Kamesh, and thank you again for presenting the report. Finally, I will also introduce you to our lead moderator today, who is Pavan Ananth. He's the founder of Pravesh, but maybe Pavan, you can give a brief introduction of yourself and we can start with the discussion.
Yeah.
Thank you, everyone. Okay. Thank you so much, everyone. Hi, my name is Pavan. I'm the founder of Pravesh. We are an innovation consultancy based in India, and primarily we look into supporting, the access, adoption, and documentation of, new innovations, emerging trends in healthcare. And so this research that we collaborated with our partners in India, the Dialogue, as well as our partners in EU, Hertie School. Is I think at a very topical and opportune time as the world is also moving towards, trending towards getting healthcare digitalized and going towards the goal of, universal healthcare coverage. So maybe as I start, the panel. The first question that I would really ask the panelists is, a much more open-ended, broad question, which is really around, is digitalization the next big thing in healthcare? And how has it contributed towards the goal of universal healthcare coverage, equity, as well as creating wealth? And, one of the intentions to ask this question is as well around, as EU, India, and other geographies around the world grapple with making investments into digitalizations, how do they look at the return on investment? How do they also look at making sure digital initiatives are going towards UHC and bringing equity in healthcare? Maybe if it's okay, I'll start with you, Jubin, and then we can go to Carolina and Neeta.
Hi, thank you so much for the kind invitation, and it's wonderful to be part of this great panel, people with so much experience. I thank you for the invitation again. Maybe just a quick point on what you tried initiating. So if I look at the big picture and the title of the discussion today, which is digitalizing healthcare. So I've been discussing this topic, at least in my career, for last 5 years. And I know people who have been discussing this over last 10, 15 years, and I'm pretty sure that you will also hear that. So we have been discussing that, but where are we right now? So if I look at the big picture and why this discussion is important, so if I just rotate the map and see which are the regions in the world which are stable, which at the political level, at the cultural level, at the financial level, I'm pretty sure you would find European region or the EU and India as top two regions in the world who would come together in why there should be a strong collaboration in healthcare. Just to add to that, you see a lot of migration between the two regions, and that adds value why we need further collaboration on that. The second point I also wanted to make towards the big picture would be the patient perspective. So I'll just give you an example. Yesterday I got a minor fracture. I went to orthopedic doctor and he took an X-ray, and he also recommended me to go to a specialist. But he gave the files in a CD and asked me to take it to another doctor. I mean, we are living in 2023 and we are transferring the data through CD. And that took at least a couple of hours of time in the whole process. And similar example where a relative had to get an MRI done. It took 1 month to transfer the data from one doctor to another. So where are we discussing and where are we in the implementation? I think those are the two key points, and how it really impacts the patient themselves is something which we need to really discuss about. Yes, you would have people from the stakeholder side, but how it really impacts the patient is something which we really need to understand, and that's where we would be able to understand how it gives the ROI or the value itself in terms of the health outcomes. Maybe we can definitely go further into that.
Well, I'm thinking about this question, and of course I think we could discuss it for a week. There is so many things to unpack, and now thinking about the patient perspective, I think we all have those stories, but maybe still trying to look at this from the big picture. You ask if the digitalization is the next thing in healthcare, and well, I think the obvious answer is yes. I think the obvious answer is there is no other way, and for many, many reasons. One of the reasons, I think, what we experience everywhere in the EU, and I think also elsewhere, is the lack of resources in the healthcare, and at the same time increasing needs of the population when it comes to the healthcare system. And of course there is a number of statistics, and we've heard about this during COVID times, that of course there is this healthcare debt that we will have to pay back. We're paying it back. At the same time, of course, the population is getting older, not only in the EU, it's like in many countries 1/3 of the population is already older, but also I know that India is like going into the same direction in a couple of years, in a couple of decades. Of course, you are also, India is also there. So we have, and in many countries, I come from Poland, but I live in Finland, and for many years Finland was considered the best healthcare system in the world, but it's not anymore. It's actually the system is at the brink of collapse because of the lack of the doctors in public sector. So the public sector has to buy the doctor's time from the private sector, which is completely twisted, but that's another story as well. So of course we need digitalization, but not only for the sake of optimizing the resources, that we can have robots, we can have AI, we can have like solving or covering the different services that we actually don't need the specialist knowledge by the technology. But we also have of course, the issue of distances. That's the same, I think, in India, and it's the same in Europe. Of course, when we are in the city of Berlin, maybe we don't think about distances, but then again, living in the Northern Europe, there is a lot of communities being far away from the specialist health facilities. So this is also something where we can see the opportunity. And aging, I already mentioned. But again, like what was said, implementation matters. My mom used to work in a hospital, and when you will speak with her about the digitalization or bringing the new systems, she's just getting like, oh my God, don't tell me about this, because in her career, she had to deal every year, I think, with different systems being implemented, but those systems never like collaborated. So it means that instead of writing one paper for a patient, the discharge letter, and maybe sick leave, she had to like put those documents into 5 different databases, one for the insurer, one for the employer, one for the patient record system, and so on and so forth. So we really have to think about it, that it's not only about bringing more technology to the system, but actually making sure that people use this technology for better outcomes.
Excellent. Thank you so much, Carolina. Nita, I think as you kind of talk a bit about the digitization in healthcare and how India is doing, I would also like you to maybe resonate on some of Carolina's points, really around um, the doctors' availability, also around these different systems, because I know India is grappling with a lot of challenges with bringing insurance and EHR, electronic health records, and making them communicate. So if you would also be open to sharing some perspectives on that.
Thank you very much. Such a pleasure to be here with my distinguished panelists, and thank you, Pavan, um, for inviting me. I found myself smiling broadly when Carolina was sharing the experience of her mom, because I think that's what really it is. I mean, and again, I agree with her. Probably there is no other way, right, than to go through the digitization of it. But I have often wondered. So my journey in health started 2017, right? And it was basically working on what we now know as national health stack. But at that point in time, the problem we were trying to solve was very different. It was about what India should do as a, digital strategy. I'll come back to that, but I think I just wanted to. I've thought hard about it often, and like, why hasn't this taken off? Even though we feel that this is the way to go, why haven't we it taken off? And it is, I think, one, it takes a very deep understanding of the incentives, which are there. And at this point in time, they are actually adverse incentives, if you may call, right? And I think the other thing is the articulation of the benefits of digital health. I think that is missing, the measurement of it and the articulation of it. So I remember writing an article, uh, you know, once after attending a conference, and I found myself saying that it is not technology, it is not policy that will fail, digital health, but it is actually the articulation and the measurement of when we say that these are the benefits, the ROI you started with, I think, talking about Pavan. So I think that is one. Now, I just wanted to highlight, one of the things, or maybe I can share my experience, just like Carolina said. In 2017, I was looking at the launch of non communicable disease health tech systems for Ministry of Health, together with two NGOs, Tata Trust as an NGO, and then corporate, Dell EMC. And my interaction with ministry actually saw that the silos which are there in the ministry, right? And how these silos actually travel down, they percolate down to the frontline workers. So, when we wanted to launch this app or this health tech system, now obviously the users are the frontline people. I had no single source of truth to actually get hold of this data. So if you can imagine, there are 21 silos in the ministry, each one is having their own copy. So that tells you, right? I mean, there is no single source of truth. These are just databases. These are not live registries which tell you who is alive, who's dead, who's where, who has moved, right? So all those, problems start happening. Now, when you go on the ground, you find these frontline workers. They're grappling with, I think, like exactly what you said, Carolina, right? They had some 20 apps. Even if they had one tablet, on each one of them they have to log in separately, and collect maybe the same data that 20 times, right? So what happens is they become like generators of data, all they're in parallel silos again. And it really is not funny, because they are over fatigued, they are underpaid, obviously, and they don't get access to the data which is actually collected for some kind of decisioning, right? How does it go back to them to be able to do their primary work, which is to look after the patients, right? So I'll stop here. Probably I'm, overstretching my time. There's so much to say, but I totally agree with what is
Yeah.
being said here.
You know, I think very, very valid points, Neeta. In fact, I recall when I was doing some field visits to some primary health centers in UP and Bihar. I mean, the frontline health workers who are your auxiliary nurse midwives, the social health workers, ASHAs, they end up, I think, spending couple of hours a day just they'll probably have to do it on a paper and pen first because they're going to these remote areas, and then there's the expectation, oh, you got to upload it, and at the end of the day they don't know why they are uploading it and what are they going to get out of it, right? So there's in a lot of ways it's like, why am I collecting the data for the sake of collecting the data, right? I think Kamesh, if would love to also hear your perspectives and add on to this, and perhaps also maybe you can touch a little bit upon the secondary use of health data, and I would also like to maybe circle back to the other panelists for their perspective on that as well.
Thanks, Pavan. Yeah, I think everything is mentioned already by Nita and Carolina in terms of what's the state, and especially one point that also bringing back a study itself is that looks into is the regulatory interoperabilities and the silos that they work within, which actually could increase the the burden at the last mile, as well as might actually stifle the innovations that are happening. So coming back, coming to the secondary aspect itself is I think that's one of the aspects that the EU is very much looking into through their EU health data space, in terms of how can we use the secondary kind of aggregated level data usage. So there again, I want to circle back on one more point in terms of the constraints which actually happens at the level of two. One again, circling back on the same aspect of the regulatory frameworks, because why am I coming back to the same point is that sometimes when the ministries are not talking with each other, which is the case within Indian jurisprudence, the fruition of the secondary usage of the data, which is aggregating the data, has Nita pointed out, you're forming 10, 20 forms, and maybe in all those 10, 20 forms, there might be some unique aspects which actually are also the mundane aspects also. But when those forms are not talking with each other because one ministry to the other is not talking to each other, that there is where I guess the problem in terms of bringing the systems together itself is a concern. So most of the times when we talk about bringing the systems, we are mostly concerned with the the technicality aspects and other operational infrastructural aspects, but regulatory angle is very important. Another is the resource constraints itself, right? In terms of as Jubin mentioned, most of the times many of these data points that we want for the secondary use are not even in form of digital. So I guess there is also a resource and infrastructural constraints which comes in terms of how we actually convert such information towards moving towards the digital platform aspect itself, right? If you go to the remote areas within India or etc., we will not really find such infrastructures available for one to have their information fed within the system. So I'll just stop there and would love to come in. Yeah.
Sure, sure. Thank you so much, Kamesh. Carolina and Jubin, would you like to add, something on the secondary use of health data, and how has what's kind of EU working on that, and where do you see scope of collaboration?
Right. Maybe I will comment on this, I also want to comment on the breaking the silos, the need for breaking the silos, so something that Nita also raised. Of course, about the secondary use of health data, I think that this is, again, the thing that we all understand that is very much needed, because there is so much data collected, gathered, and processed, and finding the way how to really distill the data and use it for. One thing is, of course, for better diagnostic, but the other thing is, of course, for prevention and the decision making on the healthcare policies. But I think, again, the issue here is like how we are really, like how will we implement it, how we will really make sure that those systems are not only technologically and legally perfect, but they also are user friendly. I'm really excited about the European health data space. This regulation should be now voted in the first half of November, hopefully. So meaning like any day now. But I'm also like scratching my head thinking like how we are really going to do it. I was last year at the meeting in Spain, and there was a colleague from Catalonia and saying, guys, we have like 500, 600 different systems that the data sources in the hospital, how we're going to really like make sure that, this is interoperable and really brings the value to the whole system. But I'm sure that one way or another we will find a way. Of course, there is so many different projects, initiatives going on. But maybe linking this to this need to break silos, and I think that definitely we need to do it, because it's like, even if we stay like, okay, there are technology developers, then there is legislators, then there is hospitals, I think we need to like make sure that really this whole ecosystem works together. This is also something that my organization, the ECH Alliance, is doing, that we bring together those stakeholders that sometimes they don't even know that they exist, and they can work in one region, one city, one hospital, and then they meet at our event or online or in person, and they're like, oh, really, do you work on this? I didn't know that you exist. I didn't know that you have this project in your department. So this is really something that I think if you, for example, would ask me like, what would be this one small step that we all can take, it's actually this: be curious and like try to know what the other departments, the other sectors are doing, and learn a little bit how this looks from the other perspective. I'm not a technologist. For me, sometimes listening to the whole architecture, it's just like very difficult, but at least I try to be part of this discussion to also bring the more social and more policy perspective. Yeah.
Great. Jubin, your
Yeah, I was just trying to gather my thought on the topic. Again, it's a very interesting and important question. Because I focus on product side, so I always think from a patient or a user perspective. I was part of a panel discussion a few years ago where we had patients, again, from a patient perspective from India and a patient perspective from Germany, also representing EU. And we had a question where, okay, what would be more important, access to technology and care, where, okay, the regulatory or the technology itself is not fully compliant with regulation. And another topic was, should it be fully compliant and not be accessible at all? And the answers we got were very interesting. The patient perspective from the Germany or the European region was, okay, we are okay if we don't get access to the technology or the final care, but we would like the consent and the compliance to be made sure that it has to cater to the regulations. And on the other hand, when we heard the same view from the patient perspective from India, the context was, we need access because we don't want to die. The final endpoint is, okay, we don't want death, we want access. For us, it's okay if the consent is managed somehow, or if the whole compliance is managed in the process, or it would cater to at some point. So this is something which is an important point also in the context of secondary use. Maybe just to add to the topic of interoperability, again, because I focus on the product, I would like to take you to the social context. Let's say if there are and three different set of examples where a person from a rural region from India who comes to Germany without knowledge of German, without knowledge of technology, and goes to, let's say, East Germany, some rural region, and there you meet a person who does not use technology and does not speak English. So how do those two people interact? And you have many systems within European region or even in India who do not talk to each other in this context. So that's first scenario. The second is where you have a person, let's say, coming from a mid-sized city from India who knows English a bit, and he or she meets a person from Germany who also knows English a bit, and they're able to talk a bit, and there is some exchange of information. So the second category is that kind of systems where you have some exchange of information happening. The third is the one where we would like to push it where, okay, you have a person who speaks a bit of German coming from India. You have a person from Germany who speaks well fluent English or at least understands English, and they're able to communicate each other, although not in the same language, but you have an interface through the use of technology where the exchange is happening. And the issue right now is we are still stuck with the first and the second level, and we are not able to move to the third level. And that is what we would like to move towards or push towards. And then comes the context of the secondary use of the data. So even, for example, our company, we work on the use or developing a platform where we could leverage the clinical data from retrospective manner and help organizations to use it for the secondary purpose. There are regulations, there are technology aspects, but how do you cater to pushing the attitude of utilizing it is something the core of the whole issue, at least that's my perspective. But yes, definitely there would be added layers which would be playing its own part.
Wonderful. Yeah. So I've heard a lot about the importance of being making systems that talk to each other, that are interoperable, and where you have some common fields. So that really activates and amplifies the secondary use of health data for driving decision making, predictive modeling, and so on. I want to come back to the whole, the regulations around the interoperability framework as well as, the data security around it. But maybe, I want to switch gears slightly to go to, what is, like, why are we all here, right? Which is, collaboration. And one of the key themes of our paper is, how can these two, vast geographies, jurisdiction, the European Union and India, how can they collaborate? Well, firstly, taking a step back, is there a scope of collaboration between these two geographies, and at what level? And maybe I'll go to you, Neeta, and while you kind of ponder over this question, because you were involved in the the original national digital health blueprint in India back in 2017, and you were kind of one of the key people who built the framework and the policy around NDHB, which has now been Ayushman Bharat Digital Mission. When you were working on that, did you kind of look at references, like global references of digital health blueprints, ecosystems? Did you look at some countries in the European Union, and what were some of your inspiration as well? Maybe if you could touch a little bit on that as well.
Thank you, Pavan, for that question, because this research is something that I started my baptism sort of into, into this field. We did a lot of research. Basically, the idea was to kind of see what works, what doesn't, etc., etc. But I think that if I have to encapsulate my sort of learnings from that research, it was that India is very different to any other country, right? And therefore, our approach has to be very different. I think this was very clear. At that point in time, we didn't know what the approach is, but we knew that it is not something that we can copy and paste from any other country, leave alone other things, the size of it. So even if so basically, there are three things that are required in healthcare: affordability, accessibility, and acceptability. And first, my research kind of pointed out there is not a single country which has got the balance between the three. Even if there is, the size is incomparable to what, India has. Second, I think the biggest differentiator is that in India, however little the government spends, so you would have heard some controversial figures, but which don't go very far, 1.2 to 1.8 to 2% of GDP, people keep arguing about that India spends so less. And I find myself saying that, hey, even if it were made to 5%, that money will not be spent because even this minuscule amount is not being spent. And why is it not being spent? Because there are frictions to this money being spent, right? And you get the point, right? So the government is basically saying to 500 million people that, hey, I'm here to pay for you. But this service has to be provided through service providers. And then you need the insurance providers, right? So this whole lack of trust between each other, which increases the cost of any claim that is, goes for, from a service provider to an insurance. It's almost like 800 rupees, almost like, I don't know, is it $20 or, something like equivalent, 15 to $20. And when we talk of Indian healthcare, we are striving for universal healthcare, which means IPD as well as OPD. How can a $1 OPD, right? We can hope to get that passed by our insurance. I mean, they will die. Even today, they're just sort of about there. If you see in insurance, health is not out of choice that it is offered, right? So I think that's the biggest difference, that the strategy, and that was basically unfolded through what we call national health stack. Basically, it gave a direction for how even that money can be spent, how trust can be enhanced, how these frictions can be reduced, and obviously digitization is the answer to that. So I'll stop here, but that's the biggest learning. As we are looking at the collaborative, I think we also need to understand what are the differences, because then we can go down the right path.
Great. Thank you so much, Nita. I think over to you, Carolina. Same question, but I would also like if you can perhaps ponder on some of the recommendations and insights that Kamesh presented earlier, right? And maybe specifically around some recommendations that we have highlighted that India can learn from EU. And maybe your perspectives, you've kind of you're from Finland or from Poland but living in Finland, so you have, I think, a good handle on the whole jurisdiction, European Union, different countries, right? And the policies over there. So I think maybe something that we can learn, and your perspective.
Again, a massive question, and of course I think by now you know probably that I'm like a fan of collaboration. I think that this is something, again, out of question. We need to meet, we need to learn from each other, we need to be curious. And actually, I wanted to congratulate you on this report. You've heard that the report is not published yet, but I was one of the lucky ones to have a chance to read it. It was really eye-opening. I learned so much about India from this report. We, as the organization, we have some collaboration with India, and under our Global Health Connector partnership, we also facilitate the collaboration between the European organization, Indian, African, Northern American, and so on. My colleagues have traveled to India for the events, and we have this exchange. So some understanding was there where we can collaborate and what's the opportunity, of course, business opportunity, learning opportunity, but this report, again, was, I hope it will be published soon and I can disseminate it to my colleagues. You asked me if I can refer to some recommendations what India can learn from EU, but I actually wanted to pick on something that you recommended to the EU, or I don't know if that was recommendation, but that was one of those challenges or barriers. I think that was this cultural issue of the resistance to change. And I think that this is also something that Nita raised and also you raised with this constant issue, like, are we really like, do we want to be legally ideal and perfect, or are we allowing ourselves a bit of flexibility to take embrace the benefits to get the best out of the system? And I believe that we have technology, we have legislation, so it's really in the mindset to change and to feel a bit more relaxed. Of course, I believe also in the power of legislation. So it's just to be clear about that. So I think that this is very good that you also pointed this out. I hope that, as you said, like also the European officials will read the report, and I hope that actually this will become a bigger thing, because I think that it's really. I also believe in the systemic change. So it's not only that you bring again technology legislation, but you need to work with the whole system. And it's very easy to tick the boxes to just say we reached this target, but then you see that nothing is changing in the system. So I hope that we can actually learn that. And what you can learn from me, I think I leave it to you to. But I think it's also great to see that we can really learn from each other, and India is such a big country, and there is, I think one thing that I also heard on one of the sessions was that in India the scale is so big that it's not about pilots, everything is just implemented. While in EU, we are a bit like in this disease of the, we love to have pilots, and the EU finances a lot of pilots, and the pilots are done, and the data is collected and evaluated, and then the project ends because the funding ends, right? And then we have a project, how to scale innovations. And then the project does the pilots, and then it ends, and so on. So we are a bit in this vicious circle of the piloting. So I like this approach that's like, let's go, we can always stop, we can always pivot.
Yeah, no, I think great point. In fact, since we, I think, started the digitization of health records and, the ABDM program, it I think galloped right from the start. And, more recently in the last year or two, there's been a bit of, hey, let's just step back and look at how it's going. And more recently, actually, the government has started this initiative called microsites, where they are looking at, okay, let's focus on one city to begin with. So I know that it's been started in like Mumbai, in Gandhinagar, which is another city in Gujarat, where it's like a few million people. And let's get all health professionals and people with the health ID registered on the health professional registry. So I think, we are also having to take, step backs, look at, okay, let's try this. I think this is we're going to learn a lot from it. We're going to get the impetus, and then, this microsite can be taken all across the country. I do definitely want to get a little bit deeper into the data security and privacy angle. I know Mujaheed has a couple of questions, but maybe before we go to that, Jubin, just a quick 2-minute as well, on your work in the EU-India collaboration. I know you're also part of the German-India AI bilateral forum. How do you see this collaboration playing out, and what's been your experience as well?
Yeah, again, an interesting question. Maybe just to quickly also go back onto your question about what can India learn from EU. I think one of the points is, and again, this comes from my personal interactions with a lot of stakeholders, either from the patient side or from the companies or from the regulatory side. The aspect is, if you have a data breach, for example, in India, in today's time, how do you address it? And if the person whose data has been breached, how can the person go to a body or a council where they can register a complaint, and how quickly that would be addressed? There is a provision within EU to do that, and it is addressed within a particular time frame, but that is something which I feel should be addressed within the Indian context. Now, coming to your point about the collaboration aspect, when I went to the European Union website, I noticed there are only 2 types of personal data which are allowed to be shared outside of EU. One is on the passenger list, and the second is on the terror list. So that goes in a very different direction. But I was very surprised that there is no discussion on, can there be a provision where even the health records or the information on health is exchanged outside of EU, and especially with countries like India, where, just to put that in context, Indian diaspora is one of the highest in any European country. So you would need provisions where there has to be some exchange. Now, when I go to the point about the collaboration, and so I started this just as a small LinkedIn community, that we need to talk about AI, we need to talk about the technology between Germany and India, between EU and India, but how can we facilitate that? One point which has been reflected in, again, in my interaction has been that people are not aware that how the data is being used by the algorithms, what is going on behind those computers or behind those algorithms. So what would be the factor which would say that, okay, the data would be used for this purpose, for secondary purpose, but also going beyond that purpose. So that is something which people really fear about. Coming also a bit from the technology side, I think it's about the digital literacy which should be provided to the community or to the data whose data is being used. That is something which is very important, and that's where I see also the collaboration between the two regions. So if you bring in the communities or the patient stakeholders from India, or for example from Germany, through trusted partners, for example, through any university hospitals, or for example, let's say Tata Trust within India, and you make them engage that this is what the value we are trying to provide by providing this exchange, and that's where you get a starting point. And then you go to the next level, building either the sandboxes or building the framework that how would the data exchange happen within the regulatory environment of India, of EU, and also in a way where this data would be relevant for the future technological development in context of AI, quantum, and all those things which are coming by. At least that would be some of my thoughts to go into that direction.
Right, so thanks, Jubin. We have a very young audience walking by over there, if you can notice that. So I ask for your patience with them. They are the future of digitalization, I hope. So we've discussed a lot about data privacy and data security, and the question we come back to again and again is this idea of privacy versus the value that we can derive from that data. So what is the trade-off that we're willing to make? How private should we keep this data versus, are we foregoing some benefits we can take out of, letting it be available for everyone? So my question to that is, in the future, so we have all the regulations in place now, but ultimately it boils down to compliance. It boils down to individual companies, insurers, it boils down to hospitals complying with the directives around data privacy and data regulation given to them by the state, right? So if that doesn't happen, then there's no point in discussing what regulations we want to have in place. Do you see that there is a compliance problem at the moment, or these organizations that actually are responsible for deploying healthcare are unaware of these regulations, or there's no incentive or disincentive if they fail to comply or if they comply with these things? So do you see that as an issue? And going forward in the future, do you think that's going to be a challenge? So maybe I start with Carolina if you want to come in.
I think I started to think about it, and just run a couple of different cases in my head about the compliance. I think what we did great in the EU, of course, is the GDPR, and I think you refer in your report to that as the golden standard of the data privacy. And I don't think we have any problem with compliance. I think we have a problem with over-compliance, right? So often the organizations and the companies, well, of course we have the cases where the companies and organizations were fined. So, but I think that there were pretty severe cases or pretty obvious cases of some data breach and data misuse. While we have a problem of the over-compliance, what I mean by this is often that we like also have 27 different interpretations of the GDPR in the EU. So I say that when I'm in Finland, I see that things are a bit more relaxed. There is a bit more, well, not relaxed, it's still, we go by law, right? Things are done properly, there is consent and so on. But at the same time, there is a bit more understanding that, you know, not everyone just wants to steal your data. It's like, you know, there is trust, I think, that the data will be handled well. While when I go to, and then when I'm in Finland, I believe that EHDR, the European Health Data Space, will actually happen. Then I want to go to Poland or even Germany, and I'm like, oh my God, like, you know, you cannot really, like, even in, you cannot have a name of people living in the apartment building because it's not, you know, according to the GDPR. People go to the doctors, and doctors are afraid to open the door and call people by name, so they call them by numbers or initials. So, you know, this kind of very like silly example shows you how like people don't really understand what is really there in this regulation, and they're afraid to make an error. So instead of just like trying to understand what is the scope and what is being allowed, they just like withdraw completely. And I think that this is something that we have to be very careful about, because this, if we then again we go with the data space, and we'll have again 27 or any other regulation. We have Digital Data Act and so on. Now, if we will have 27 understandings of what this regulation means, then we are actually getting into more trouble probably.
Okay, thank you, Carolina. So there is apparently overcompliance. It's just the same question of, are we over-regulating digital health and stifling innovation by doing that? Let me ask Neeta on similar lines. So as we heard from Carolina, in the EU, you know, we probably have a problem of overcompliance. In India, however, do you think the situation is different? Do you think there's a problem of compliance? Because we're not at that point yet where we can talk about over compliance. And I can give you sort of an example that we have in the report where we map the guiding principles, and we, in the nature of adoption, apparently the ABDM framework enables voluntary participation in this digital health ecosystem and does not mandate the key stakeholders to adopt the framework, whereas in the EU, it is, by virtue of being a regulation, it is mandatory. So if it is not mandated, how do we ensure compliance then?
Yeah, that's a very tricky question, because initially when it was announced that it is voluntary, I was like, really, uh, this will have impact on adoption. But I think then you fall back on what is the value for it. And I think if it is not, if it is voluntary, then it has to be backed by a very strong reason, which it should be in any case, whether voluntary or non-voluntary, that what is in it for me to be compliant. So I think that is one very important factor to consider. Um, I would just like to also touch on this whole privacy issue, because I think because of these things in India, um, I think digital public infrastructure is sort of a kind of answer. And I have to say that while I started my journey designing, about this digital public infra, which is now ABDM for health, I had the opportunity to actually work on in urban in governance sector. And here I'm very happy to say that we have actually built DPIs, we have implemented them, and we have seen the results also, right? So one of the examples that all of you know of, and I think one of the principles of DPIs is privacy by design, so that the whole compliance thing becomes easier on people, right? So we all know during the COVID, our vaccination certificates, right? By the way, they were the first digital health record for every Indian citizen that came as a default, right, of COVID. Now, this COVID certificate, basically it was required because even though all the attention was on, you know, creating the vaccines, their distribution to facilities, et cetera, but how would we prove that we have got vaccinations? So I think this is a thinking we started doing at eGov, and a community of, our leaders in Bangalore, was that we'll have to have a proof that you are vaccinated so that it opens up lives and livelihoods. And I think sometime back, Carolina, you mentioned that in India everything has to be done at scale. Well, it has to be. There is no other option, because if imagine DIVOC, which basically reached 2 billion, it is right now 2.5, but 2 billion 18 months without a single glitch. That was the only way to make it successful, right? And not kind of you try to get your certificate and it is buffering, and or rich have access to it and poor don't have access to it. Now quickly I want to bring to the point that when we use this certificate, it was acceptable in 120 countries. So again, I'm talking of movement of digital health records, from India to other countries. It was possible, and there is a lot of work that is happening, I think, under WHO, probably to make sure that how these digital records can be exchanged, and the information. And two, privacy by design. Now, when we gave this record at the airport, right, they looked at it, basically verified, and it said yes or no, right? If it is valid, it said yes, you have been vaccinated and you can travel. But it did not take any of my details, my name, my contact number, my gender, which is often the one which is most abused, I would say. So I think I just wanted to bring that whole thing of privacy by design, I think, which is an important factor here to make sure that the compliance is,
Thanks, Neeta. I'm not sure if you guys can hear Neeta clearly. You can? Okay, great. Great. So I think that's an excellent point, because for the longest time I've been wondering if there is a possibility if we will ever be able to exchange health data between the two jurisdictions. But the fact that we've already done that during COVID when we moved around with our vaccine certificates says that, if it's a global problem, we are able to do that. So I think there is some scope in that area. Kamesh, what do you think about the compliance issue? Because it's our report in a way, and you've been sort of the primary writer of the report. So what do you think about the compliance problem?
Thank you so much, Mujaheed, for that question. That's very important question, at least for the India sake, because like we are just going into compliance with the new, the data protection bill, enacted. So here I have like 2 points to make, and it's more on the levels of like the perception level aspect, which I think like Carolina also pointed out, during the resistance to change. First, let me come towards the supply side, which is like, your data fiduciaries, which is the data controllers in India. So I guess like, the one way to look at this, like the voluntary aspect itself is like, how can we actually move this maybe long term? But like, one thing that we've also looked into the report is like, how can we move beyond like looking this, the privacy as an element of compliance, and like also seeing that as a value proposition. So how can we make that as a competitive element for like, the, supply side, such that they don't really have to like see this as something as a burden, rather like move towards like, doing it on themselves, because in long term there can be some, the positive implications to themselves in terms of like trust building and etc. and stuff, where like some of the popular companies have already done that. So that's the important piece that comes at the supply side and the compliance. Being, also like I wanted to like little bit touch upon the point on the data protection itself, right? Like the trade-off thing that Mujahid you mentioned. So I think like again here, I guess like, one aspect that as we are just moving towards like, having a legislation, though we have the right for a long time now, like a couple of years now, but right to privacy. But I think it's very important we take the image and the perception behind data protection clearly out there, in terms of data protection doesn't really mean that like, you shouldn't share your data. It means like, share your data, appropriately for the purpose for which it is. So I guess like, that message is very much important. And I guess that's also one of the key learnings that we could like pull out from EU's experience itself, right? Like, some of the experts also mentioned that just because there has been like a lot of laws and like, no flexibilities and rigidities within the law, which Carolina also mentioned, people are also like very much acclimatized to this idea of like, sticking with that, and like, thinking that, oh, if we move beyond of this, that means we are trading off our privacy. So I guess like that message has to be put out very clearly when it comes to demand side, in terms of data protection really means is like, sharing data appropriately when there is a protection and that for the purpose. So yeah, I'll stop there.
Great. Thank you so much. We are almost at the end of our discussion, but I do want to, kind of go over the buzzword these days, which is, of course, AI. So everybody talks about AI. Nobody can stop talking about AI. Just recently, there was the AI Safety Summit as well that happened, where I think a lot of discussions at a policy level happened around the dangers and the ethical usage of AI. In just the last, we have maybe a couple of more minutes, but rapid fire, 30, 30, 40 seconds, each panelist would love to hear your perspective on, the use of AI in healthcare. Where are we headed with it, and what's the scope and dangers? 30 seconds, maybe we'll start with Jubin.
Yep. Thanks, Paul. Maybe before that, I again wanted to mention about compliance. I think the aspect we see here also is you see a lot of data flowing around across, and then you have sometimes breaches in between. And that's how also the compliance works, where you have some breaches where the data or the technologies which are not compliant come in. To the point about the AI, I think it would be a tool which would be there for the future. I think it's something which we realize later in the point of evolution itself, and I personally believe it would shape how humanity would evolve, but it would not lead to extinction, which is how it's made out to be. In terms of the healthcare itself, I personally believe, and this is something which I see across the community itself, that it would be something which will complement the capacities of the doctors or the healthcare staff and help them to perform their duties better and finally benefit the health outcomes itself. I think that the people who would be left out would be the people who are scared or who are not looking to adapt to the technology, and there they would lag in making their interventions or providing the outcomes to the final end user, which is again the patients. And again, from the patient side, I think it's important for them to understand that how AI would impact or what algorithms are being used, how it would be processed, not in the literal sense, but at least in a basic science sense. I think that's something which is important and relevant down the line, at least for a decade or so.
Excellent, excellent. So yes for AI from Jubin. I think from a patient perspective, we need more awareness of how that works, and I think there's a lot of potential for, bridging the gap with, diagnosis and supporting doctors and the healthcare system as a whole. Over to you, Carolina.
I can only second what Jubin said and then expand it, that then this also means like embracing or maybe one thing about the benefits of AI. Of course, we see, for example, this in radiology, right? Like reading the results like better than any doctor could do. But this also means that brings us back to the availability of the data. We have to train the models. That brings us also to the issue of regulation. Here, I would say that we better don't under-regulate. What EU is doing with the EU AI regulation, I think it's a great thing and should be supported, that we actually are able to understand what's the model, what's the system, how it works, because actually people's lives are at stake. So it's not even about stealing data, using data or misusing, but really like people's lives are at stake. So yeah, I think those two things are definitely matter. Skills, of course, like also skills of patients, but also doctors. And this also means we will have new occupations. We will have new jobs. You have to bring to the hospital people who don't do anything medical. They deal with data, they deal with the AI, and you have to also bring them as part of the healthcare system. So again, breaking silos. This is a new skill needed from everyone.
Yeah, no, absolutely. I think great points. We can maybe even expect a human doctor to perhaps make mistakes, but an AI cannot make a mistake because lives are at stake, of course. Neeta, over to you.
I think quite much has been covered by my fellow panelists, and I definitely had written out here on the training data sets for AI, because I think that is very important. It's garbage in, garbage out. It's like, the analogy that I give here is, recipes. Sometimes you pick European, American recipes, And I made a note for myself that when they say put one egg, I use at least 2 to 3 eggs, because in India the eggs size is much smaller, right? So it is very contextual. I think you have to understand what is for a white male, all these parameters, etc. They don't apply to a different race, right? So I think that importance has to be given to the training data sets. And I think the second point I want to make is basically regulation follows technology, and it is a bit too far. It has a lot of catch up to do, and I just hope that somehow regulation is able to keep up to pace with technology and not go too far behind, because that's when all these problems occur.
Yeah, excellent point. Emphasis again on the regulations and the need for the pace at which the policy and regulations evolve with the technological advances. Last, Kamesh, we've worked a lot on the report. We've looked at so many aspects of digitization, interoperability, security, privacy. I know we have also touched a bit about AI in the report, but your quick perspective on this.
Quickly, Pavan here, like 2 points that I wanted to make, like it again resonates with whatever we discussed, just we keep talking about AI regulations, what do we really mean by AI regulation has to be fleshed out. Because I guess when we really talk about healthcare within utilization of AI, the ecosystem has various players within into it, which starts from your AI developers, then your AI deployers, your hospitals, and or the healthcare facilities, then the doctors themselves, who the AI users who actually technically use it. So I guess understanding that there are various individuals and various stakeholders present within this ecosystem, and mapping the liability accordingly will be very, very essential as we move forward in terms of making them entirely the AI responsible. The second point that I quickly wanted to come upon is that basically on the regulation aspect itself, right? In terms of this is one of the things that we looked into the report also, in terms of the consent artifact, giving that an example, right? How the consent artifact can actually apply in a situation artificial intelligence solutions is going to be very difficult. So I think there has to be some level of understanding in terms of how our regulations should evolve in terms of in tandem with the evolution of the technology itself, such that we can make it secure, and it doesn't become a burden for us to follow something which is there already. So yeah, thank you.
Excellent. Thank you. Thank you so much, Kamesh. Maybe that could be our next research topic, which is really around, collaboration in exploring AI in healthcare and the regulations around it. I think we are at the end of our panel. Thank you to the panelists. We have a couple of minutes more, so, open to any questions from the audience. Yeah, I think we have a few more minutes. Yeah, please.
I think we need mic.
Hi, great panel, everyone. My name is Tushi. I'm a public policy student at the Hertie School, a student of Mujaheed's. My question is more on your statement that you're a fan of collaboration. So I would really like to know, because we highlighted what sort of differences and priorities are there in case of India, in the case of EU. So in what sense, how do you vision collaboration, in what fields, in what sectors, in what ways? And also, how can we incorporate these differences for the collaboration?
Is it for me?
Anyone. It's okay.
Yeah, maybe I just a quick thought on that. I think collaboration is essential. The point is you make the stakeholders realize. How I would personally recommend, and I definitely advocate, is have strong working groups, have trusted organizations get involved in this discussion. Also understand at the regulatory level that health is not just essential part of life, it's security of life, and it's security of a country. And if you put that in perspective, you would definitely get collaboration. So have strong working groups, have trusted organizations, provide flexibility for smaller startups to work at the flexible level across two countries, become part of the system, leverage data, provide solutions, see what are the outcomes, and have some quick outcomes on that. I think those are some immediate starting points. Definitely you need a agile approach also from a regulatory aspect, that okay, if there are some changes happening here, we would be open to having this a bit quicker or agile approach also at the regulation side. I think if you go about in those directions, you'll definitely see a lot more collaboration and potentially good outcomes.
Would anyone else like to add?
No, I also immediately think about, of course, this collaboration, exchange, and learning from each other. And I think about the issue of those reverse innovations that we also often think from, I think, European perspective, that we have to go to India. It's a big market, so we have to sell there, right? That's the opportunity. Or then use the IT specialists from India for the sake of our companies here. But then to think that if there is also an innovation developed in India in the, I don't know, low resource setting, and it works there, it can also work in so many different settings in this part of the world, and it might be 10 or 100 times cheaper. So we actually, again, have to be curious and learn and see what's going on there, instead of having a bit of this mindset that, oh, it's a big market, we will sell our innovations there.
Great, thanks, Carolina. Maybe one last quick comment, or yeah, Anisha.
Hello, my name is Anisha. I'm a first year MPP student, and I'm also following health policy track. My question is, in healthcare sector, we are talking a lot about digitalization, which I think mostly is to the realm of administration of healthcare rather than the human aspect of healthcare. Many of the global problems like polio or child mortality rates were dealt with community healthcare providers, not by digital interventions. Maybe in the administrative aspect of digitalization can help in healthcare, but we must not forget the human aspect of healthcare. The doctors, the ASHA workers, when it comes to India, in Bangladesh, in Ethiopia, most of the health issues were dealt by community healthcare workers. And I feel human aspect should not be overlooked when we talk about digitalization. And I want your opinion on those aspects. Thank you.
Thank you. Maybe Neeta, you want to add something real quick on that?
Yeah. So I think that's a great point, Anisha, you made, and we kind of started with that, our conversation. So all these are public delivery services, right? Which basically needs an intermediary to deliver that service to you. And this is the layer that we actually, apart from being customer centric or patient centric, I think this is one layer which needs attention. For adoption of digital health, it is very important that it is easy to operate. So I just want to say at eGov, where we are looking at digital health on campaigns in Africa, we have just launched a product. And I think the feedback that has come back from the ground is it is simple. And I think that we feel will go a long way, because if it is intuitive, right? People at the front line often are not that educated, right? So if they say this is simple to operate, I think you have won half the battle. That's
Thank
a
you
quick
very much,
answer.
Neeta. So, thank you. So we are just in time to finish. So my big takeaway from this session today is that technology may be the tool that we need, but really collaboration and knowledge sharing is the fuel that we need to run that engine. So thank you very much to all the panelists today and the participants. Can we have a round of applause for everyone today? Thank you. Oh, just in time. Oh, but maybe online.
Lovely meeting you, Neeta.
Here, I think it
Yeah, I
was
can hear.
a good session.
Yeah.
I mean, I think the only problem is you have to put things in a very short, pressy, sort of a thing. But it'll be good to have some long form discussions where really, you know.
Discussions, I definitely agree. I had to squeeze my presentation also very quickly. There was so much to like talk about this topic. Would love to like meet you also, Neeta, and like once the report is out, would love to like come and like present it to you and your team as well. So
Absolutely. No, I think it's a great topic you're working on. And I think you've rightly pointed out on data protection and the security. I think that is something we should learn from EU. Because they spend a lot of time on regulations and legislation, than on technology, whereas we go first with technology and then it kind of, takes
these
its own
things
life.
crops up like later. Yeah.
Exactly. वो आधार वाला they follow, हाँ हो गया ना, even without a mandate and all that. So I think that's the issue, but no, it's a serious one. And I think similarly for EU is really this whole DPI approach. Obviously, G20 has done enough. We don't need to say anymore. But I think at eager. So now I'm with Eager Foundation, and we are doing a lot of work on DPIs in urban governance.